Did you know that 1 in 7 adults worldwide suffers from chronic kidney disease, and most don't even realize it until it's too late? Kidney failure is often called the silent killer because the symptoms can be so subtle that they go unnoticed for years. But here's the shocking truth: early detection can make the difference between life and death. Imagine the devastating impact on your life if your kidneys were to fail, leaving you dependent on dialysis, or even needing a transplant. This is why it's crucial to recognize the warning signs early. In this video, we're going to reveal the 13 critical symptoms that could indicate your kidneys are failing. Missing these signs could lead to irreversible damage, but by knowing what to look for, you can take action before it's too late. This isn't just another health video, it's a potentially life-saving guide that you can't afford to ignore. Stay with us until the end to get the full picture on how to protect your kidney health. Number 1. Darkened skin or bruising. Darkened skin or easy bruising can be troubling symptoms, and they might be linked to kidney problems, particularly in the later stages. Your kidneys are responsible for filtering out waste and toxins from your blood. When they start to fail, these waste products can build up in your body, affecting many parts of your health, including your skin. When waste accumulates in your bloodstream, it can cause your skin to change in color. You might notice that your skin looks darker than usual, especially in certain areas like your face or hands. This is because the toxins that should be removed by your kidneys are instead affecting your skin, leading to discoloration. The skin might also appear dry and itchy. Another issue that can arise is easy bruising. When your kidneys aren't functioning properly, they can't produce certain proteins that help your blood clot. This means you might start to bruise more easily, even from small bumps or minor injuries. The bruises might take longer to heal than they normally would. It's important to understand that darkened skin or easy bruising is often a sign of advanced kidney disease. These symptoms indicate that your kidneys are struggling significantly and that waste is building up in your body. If you notice these changes, it's crucial to seek medical help immediately. This is a late-stage symptom that requires urgent intervention to prevent further complications and to manage your kidney health as effectively as possible. Early detection and treatment are key to improving your outcomes. Number 2. Significant weight loss or loss of appetite. Significant weight loss or a loss of appetite can be alarming, and it might be related to your kidneys. When your kidneys start to fail, they can't remove waste and toxins from your blood effectively. This buildup of waste can cause changes in how you feel about food, leading to a loss of appetite. When waste products accumulate in your blood, they can make you feel nauseous or give you a metallic taste in your mouth, which makes food less appealing. You might find that you're just not hungry, or that certain foods don't taste right anymore. Over time, this can lead to you eating less and losing weight without trying. This kind of weight loss is not healthy because it's often a sign that your body isn't getting the nutrients it needs. As you lose weight, your energy levels can drop too. Without enough food, your body doesn't have the fuel it needs to keep you going. You might start feeling weak, tired, or fatigued more often. This can affect your ability to do everyday tasks, and it can make other symptoms of kidney failure, like muscle cramps or mental fog, even worse. It's important to pay attention to any unexplained weight loss or loss of appetite, especially if it's accompanied by other symptoms like nausea or fatigue. These could be signs that your kidneys are struggling. If you notice these changes, it's crucial to see a doctor. Early treatment can help manage your symptoms and prevent further complications, keeping you healthier and more energetic. Number 3. Decreased mental sharpness. Decreased mental sharpness, such as confusion and memory problems, can be a sign that your kidneys are not working as they should. Your kidneys play a vital role in filtering waste and toxins out of your blood. When your kidneys start to fail, These waste products can build up in your bloodstream, a condition known as uremia. When waste accumulates in your blood, it doesn't just affect your body, it can also impact your brain. The toxins that should be filtered out by your kidneys can interfere with your brain's ability to function properly. This can lead to symptoms like confusion, difficulty concentrating, and memory problems. You might find it harder to focus on tasks, forget things more easily, or feel mentally foggy. It can be frustrating and concerning, especially if you're usually sharp and alert. To manage these symptoms, it's important to take a few steps. Stay hydrated. Drinking enough water can help your kidneys flush out toxins, but if you have kidney issues, follow your doctor's guidelines on fluid intake. Get plenty of rest. Fatigue can worsen mental fog, so make sure you're getting enough sleep. Eat a healthy diet. A diet low in processed foods and rich in fruits, vegetables, and whole grains can support both your kidneys and brain health. If you notice that your mental sharpness is decreasing, it's important to see a doctor. These symptoms could indicate that your kidney function is declining and that waste is building up in your body. Early intervention can help manage the symptoms and protect your overall health. Don't hesitate to get medical advice if you're experiencing confusion or memory issues. It could make a big difference. Number 4, chest pain or pressure. Chest pain or pressure can be a frightening symptom, and it might be connected to your kidney health. Your kidneys and your heart are closely linked in what doctors call the cardiorenal connection. When your kidneys aren't working properly, it can have a direct impact on your heart and blood vessels, leading to serious problems. When your kidneys fail, they can't remove excess fluid from your body. This extra fluid can build up in your bloodstream, causing your heart to work harder to pump blood through your body. Over time, this can lead to high blood pressure and strain on your heart. If the strain becomes too much, it can cause chest pain or pressure, which might feel like a squeezing or heavy sensation in your chest. This can happen when the heart isn't getting enough oxygen due to the extra workload. It's important to understand that chest pain or pressure is a serious symptom that should never be ignored. It could be a sign of a heart attack or other life-threatening conditions, especially if it's linked to kidney failure. If you ever experience chest pain or pressure, it's crucial to seek emergency medical care immediately. Remember, time is critical when it comes to chest pain. Don't wait to see if the pain goes away. Call emergency services or go to the nearest hospital right away. Getting help quickly can save your life and prevent further damage to your heart and kidneys. Always take chest pain seriously and act fast to protect your health. Number 5, muscle cramps and twitches. Muscle cramps and twitches can be painful and frustrating, and they might be a sign that your kidneys are not functioning properly. Your kidneys play a crucial role in keeping the balance of important minerals, called electrolytes, in your blood. These electrolytes, such as potassium, calcium, and sodium, are essential for your muscles to work correctly. When your kidneys start to fail, they can't regulate these electrolytes as they should. This imbalance can cause your muscles to cramp up or twitch. For example, if your potassium levels are too high or too low, it can disrupt the way your muscles contract, leading to cramps that can be sharp and sudden. You might notice these cramps in your legs, especially at night, or feel twitches in your arms or other muscles. To manage muscle cramps, here are a few tips. Stay hydrated. Drinking enough water can help maintain electrolyte balance. However, if you have kidney problems, you should talk to your doctor about how much fluid is right for you. Stretch regularly. Gentle stretching, especially before bed, can help reduce the likelihood of cramps. Warm compresses, applying a warm cloth or heating pad to the cramping muscle, can help relax it. Even though these tips can help, it's important to know when to seek medical advice. If you're experiencing frequent or severe muscle cramps and twitches, it could be a sign that your kidney function is declining. It's crucial to see a doctor to check your electrolyte levels and get the right treatment to protect your health. Early treatment can prevent the situation from getting worse and help you manage the symptoms more effectively. Number 6. Persistent itching. Persistent itching can be more than just a minor annoyance. It might be a sign that your kidneys are not working properly. When your kidneys are healthy, they filter out waste and toxins from your blood. However, if your kidneys are not functioning well, these waste products can build up in your bloodstream, leading to a condition called uremia. One of the side effects of uremia is severe itching, also known as pruritus. This happens because the waste that's not being removed from your body can irritate your skin. The itching might feel like a constant need to scratch, and it can be especially bad at night, making it difficult to sleep. The itching can occur all over your body, or just in certain areas, like your back, arms, or legs. If you're experiencing this kind of itching, there are a few things you can try to help manage the discomfort. Moisturize regularly. Keeping your skin hydrated with a good moisturizer can help reduce dryness and irritation. Use cool compresses. Applying a cool, damp cloth to the itchy area can provide some relief. Avoid hot showers. Hot water can dry out your skin and make itching worse, so opt for lukewarm showers instead. Wear loose clothing. Tight clothing can irritate your skin further, so wearing loose, comfortable clothes may help. However, persistent itching is not something you should ignore, especially if it's related to kidney issues. It's important to see a doctor as soon as possible. They can perform tests to check your kidney function and provide treatments to help manage the symptoms and prevent further complications. Early intervention is key to protecting your kidney health and improving your quality of life. Number 7. Metallic taste in the mouth. A metallic taste in your mouth can be an unusual and unpleasant symptom, and it might be related to your kidneys. When your kidneys aren't working properly, they can't filter waste and toxins out of your blood effectively. One of the toxins that can build up in your blood is called urea, a condition known as uremia. Urea is a waste product that your body produces when it breaks down protein from the food you eat. Normally, your kidneys filter urea out of your blood, and you get rid of it when you urinate. But if your kidneys are not doing their job well, urea can start to accumulate in your bloodstream. This can lead to a strange, metallic taste in your mouth. Some people also notice that their breath smells like ammonia or has a bad odor, often called uremic breath. This metallic taste or bad breath can make food taste different and not in a good way. It can cause you to lose your appetite because everything you eat might taste off or unpleasant. Over time, this can lead to eating less and getting fewer nutrients, which can affect your overall health. You might start losing weight without trying, and your energy levels could drop. If you're experiencing a metallic taste in your mouth along with other symptoms, like fatigue or changes in urination, it's important to see a doctor. They can check your kidney function and help address any underlying issues before they become more serious. Managing your kidney health early on can help you feel better and maintain a healthy appetite. Number 8. Nausea and vomiting. Nausea and vomiting can be uncomfortable symptoms that many people experience, but they might also be signs that your kidneys are not working properly. Your kidneys have the important job of filtering waste and toxins out of your blood. When they're not doing their job effectively, these waste products can start to build up in your bloodstream, a condition called uremia. When waste builds up in your blood, it can affect your entire body, including your digestive system. This can lead to nausea, a sick feeling in your stomach, and even vomiting. It's your body's way of trying to get rid of the toxins that your kidneys are not able to filter out. You might feel like you have no appetite, or that certain foods make you feel worse. If you're experiencing nausea and vomiting and think it might be related to kidney issues, there are a few things you can try to manage the symptoms before seeing a doctor. Stay hydrated. Sip small amounts of water or clear fluids to stay hydrated, but avoid drinking too much at once, which can make nausea worse. Eat small, bland meals. Foods like crackers, toast, or plain rice can be easier on your stomach. Avoid strong smells. Strong odors from food or the environment can trigger nausea, so try to stay in a well-ventilated area. Rest. Sometimes, lying down in a quiet, comfortable place can help reduce nausea. However, if these symptoms persist, it's important to see a doctor. Persistent nausea and vomiting can be signs that your kidneys are struggling, and catching the problem early can make a big difference in your health. Number 9. High blood pressure. High blood pressure and your kidneys are closely connected. Your kidneys play a key role in controlling your blood pressure. They do this by regulating the amount of salt and fluid in your body. When your kidneys are working well, they help keep your blood pressure at a healthy level by balancing these elements. But when your kidneys aren't functioning properly, they might not be able to remove enough salt and fluid from your blood. This extra fluid in your bloodstream puts more pressure on your blood vessels, leading to high blood pressure. Think of it like adding more water to a hose. The more water there is, the higher the pressure inside the hose. High blood pressure can be a problem on its own, but it can also make your kidney problems worse. Over time, the high pressure can damage the tiny blood vessels in your kidneys, making it even harder for them to do their job. This creates a dangerous cycle where high blood pressure leads to kidney damage, and kidney damage causes even higher blood pressure. If high blood pressure is left untreated, it can cause significant harm, not just to your kidneys, but also to your heart and other organs. That's why it's so important to keep your blood pressure under control, especially if you have or are at risk for kidney problems. Regular checkups, a healthy diet, and medications prescribed by your doctor can help manage your blood pressure and protect your kidneys from further damage. Number 10. Shortness of breath. Shortness of breath can be a scary symptom, and it might be related to your kidneys. When your kidneys aren't working well, they can't remove excess fluid from your body as they should. This extra fluid can start to build up in different places, including your lungs. When fluid collects in the lungs, it makes it harder for you to breathe, causing shortness of breath. This condition is known as pulmonary edema. Imagine trying to breathe with water filling up your lungs. It's difficult and uncomfortable. You might notice that you're more out of breath when you're lying down or during activities that never used to be a problem. If your kidneys are failing, this can happen gradually over time, but sometimes it can come on suddenly and feel very severe. If you start experiencing shortness of breath, especially if it comes on quickly or is getting worse, it's important to take action right away. Here are a few steps you can take. Sit up. Try sitting up or propping yourself up with pillows if you're lying down. This can help make breathing easier. Take deep breaths. Focus on taking slow, deep breaths. This can help you feel more in control and may ease the discomfort. Seek medical help. Shortness of breath can be a sign of a serious problem, so it's important to call your doctor or go to the emergency room if you're struggling to breathe. Don't wait. Getting help quickly can prevent further complications. Remember, shortness of breath is a symptom that should never be ignored, especially if it's related to kidney issues. Number 11. Swelling in ankles, feet, and hands. Swelling in your ankles, feet, and hands can be a sign that your kidneys are not working properly. Normally, your kidneys filter out extra fluid from your blood and turn it into urine. But when your kidneys start to fail, they may not be able to remove this excess fluid. As a result, the fluid builds up in your body, causing swelling, especially in the lower parts of your body like your ankles and feet. This swelling, also known as edema, happens because gravity pulls the extra fluid down into your legs and feet when you're standing or sitting for a long time. You might notice that your shoes feel tighter, or your socks leave deep marks on your skin. Sometimes, your hands may also swell, making it difficult to wear rings or other jewelry. However, swelling can be caused by other conditions too, not just kidney problems. For example, heart failure can also cause fluid buildup in the body, leading to similar swelling. Liver disease is another condition that can cause swelling, as the liver plays a key role in regulating fluid balance. So, how do you tell if the swelling is related to your kidneys? If the swelling is accompanied by other symptoms like changes in urination, fatigue, or shortness of breath, it could be a sign of kidney issues. It's important to see a doctor who can run tests to determine the exact cause of the swelling. Early detection and treatment of kidney problems can prevent further damage and help manage the symptoms effectively. Number 12. Changes in urination patterns. Changes in urination patterns are one of the most noticeable signs that something might be wrong with your kidneys. Your kidneys are responsible for filtering waste from your blood and turning it into urine, so when they're not working properly, it can show up in your urine. One change to look out for is how often you need to go to the bathroom. If you suddenly find yourself going more frequently, especially at night, it could be a sign that your kidneys are having trouble filtering properly. On the other hand, if you're going less often, it might mean your kidneys are not producing enough urine, which is also a problem. Another important sign is the color of your urine. Healthy urine should be a light, pale yellow. If your urine becomes darker, like the color of tea or cola, it could mean that there's blood in it, which is a serious sign that something might be wrong with your kidneys. Foamy or bubbly urine is another red flag. It can indicate that there's protein in your urine, which is not normal and should be checked out. Finally, the consistency or appearance of your urine can be telling. If your urine is consistently cloudy, or if you notice any blood, it's important to seek medical advice right away. If you notice any of these changes in your urination patterns, don't ignore them. It's important to talk to a doctor, as catching kidney problems early can make a big difference in your health. Number 13. Fatigue and weakness. Fatigue and weakness are common symptoms that many people experience, but did you know that they can be signs of kidney problems? Your kidneys play a vital role in keeping your body healthy. One of their important jobs is to filter waste and extra fluid from your blood, turning it into urine. But your kidneys also help regulate your energy levels by balancing the minerals in your blood and producing a hormone called erythropoietin, EPO. EPO tells your body to make red blood cells, which carry oxygen throughout your body. When your kidneys are not working properly, they may produce less EPO. This means fewer red blood cells are made, leading to a condition called anemia. Anemia can cause you to feel tired, weak, and even short of breath, because your muscles and organs aren't getting enough oxygen. Additionally, when your kidneys fail to filter waste effectively, toxins can build up in your body. This buildup can make you feel sluggish and worn out, even if you're getting enough sleep and eating well. It's like trying to run a car on dirty fuel. The engine just doesn't work as efficiently. If you notice that you're feeling unusually tired or weak, especially if it doesn't go away with rest, it could be a sign that your kidneys are struggling. It's important to pay attention to your body and talk to your doctor if you experience these symptoms. Early detection and treatment can make a big difference. In this video, we've discussed 13 critical warning signs that your kidneys might be failing, including fatigue, changes in urination, swelling, shortness of breath, high blood pressure, nausea, a metallic taste, itching, muscle cramps, chest pain, decreased mental sharpness, significant weight loss, and darkened skin or bruising. These symptoms are your body's way of signaling that something might be wrong with your kidneys. If you notice any of these signs, it's essential to seek medical advice as soon as possible. Early detection can make a huge difference in managing kidney disease and preventing further damage. Regular checkups are crucial, especially if you're at higher risk due to factors like diabetes, high blood pressure, or a family history of kidney disease. Staying on top of your health can help catch issues early. If you found this video helpful, don't forget to subscribe for more content on kidney health and other important health topics.